Navajo officials are scrambling to flatten the curve as the deadly coronavirus continues to spread through the nation's largest Native American reservation. As of Wednesday, officials at the Navajo Department of Health had 921 positive cases of COVID-19. 38 deaths have been confirmed across the reservation. The Navajo Nation spans more than 27,000 square miles with land in Arizona, New Mexico, and Utah. Its population is more than 150,000 people, giving it one of the highest coronavirus infection rates per capita in the United States. Well, the article, Checkpoints, Curfews, Airlifts, Viruses Rip Through Navajo Nation, was recently published in the New York Times. It looks at the ongoing efforts of the Navajo Nation to battle the coronavirus pandemic. Joining me now is Simon Romero. He's a New York Times national correspondent covering immigration, and he's also the author of that article. You know, Simon, when you look and you talk to infectious disease specialists, they believe COVID-19 arrived on the reservation far later than it actually appeared in other parts of the U.S. Why do you think it is that we're seeing such a surge in coronavirus cases within the Navajo Nation?
Well, unfortunately, the conditions in the Navajo Nation are really just perfect for the virus to spread. There are a variety of factors. One of them is water scarcity, so that makes it very difficult for families without running water just to do basic hygiene like washing their hands. And it also requires people to travel great distances in order to access clean water. Another factor is just how densely populated the Navajo Nation is on a home-by-home basis. And it's very different from a city like New York or Chicago, which has many people living in apartment buildings. In the Navajo Nation, you have several generations, often 3 or 4 generations living under the same roof. So that makes it very difficult for people to isolate themselves, to do distancing in a situation like that. And you also have underlying conditions for many people on the reservation. Very high levels of diseases like diabetes make it just very difficult for health officials to address the problem and very easy for the virus to spread at this time.
You know, you mentioned the difficulties they're facing in trying to flatten the curve here, but do they feel like they can get ahead of this at this point? What do you feel are the major difficulties right now?
Well, they're certainly trying everything that they can do right now. You know, the Navajo Nation, they've instituted curfews, 57-hour-long curfews this past weekend, and they're going to be doing that for several weekends into the future in an attempt just to get people to stay at home. They also have put up checkpoints all around this really vast territory. We have to remember that the Navajo Nation spans over an area that's larger than West Virginia. The police force for the Navajo Nation is only, 200 members strong. So that makes it very difficult to patrol and to get control of the situation. But really, Navajo authorities are doing all that they can right now to do this. And they are having some success. The police officers were out this weekend writing citations. They're fining people as much as $1,000 or writing citations that would mean that some people may have to spend as long as a month in jail if they violate these measures. Wow. So they're taking it extremely seriously right now.
The Arizona National Guard has been airlifting supplies, protective supplies onto the reservation. We know they've been making makeshift hospitals to help tend to the infected. I'm curious, how is the treatment process going, and are other states helping?
You know, the Navajo Nation, its territory comprises, it spans over 3 different states, so Arizona, New Mexico, and Utah. The Arizona National Guard has certainly been very active. They've been airlifting personal protective equipment. They've been assisting in assembling field hospitals in the Navajo Nation. In a similar way, authorities in New Mexico are doing all that they can to help the Navajo Nation at this time, especially in the so-called border towns that are right on the boundaries of the reservation. This is a town like Gallup, where they've been converting a hotel in that town to house people who are infected with the virus, to isolate them and keep them off the streets and out of circulation. So it's really a frantic effort. But Really, unfortunately, one of the things that they're grappling with is a lack of funds, and they're facing big delays in getting the money that they need, especially from the federal government. I interviewed Jonathan Nez, the president of the Navajo Nation, and he told me that they've been waiting literally weeks because they have to apply for grants in order to get money to address this crisis. And that's very different than other local governments around the country, such as municipalities and states that get their funds right away.